Hey, my name is Aubrie. This is a respiratory skills checkoff. Before I begin though, I'm gonna check my physician's order and I'm gonna make sure that I'm in a well-lit area for the skin test. I'm also gonna go ahead and gather all of my supplies. So for this checkoff, I'm gonna need a TB syringe, a 2x2 gauze or cotton swab, and also an alcohol wipe. So I'm gonna go ahead and read the label as I pull it out from this refrigerator. I'm also gonna inspect the vial and look for the expiration date and the date that it was opened. If this was a new vial and a new bottle, I would go ahead and write my initials and the date that I'm opening it on. So now I'm gonna go ahead and perform hand hygiene, and now I'm ready to begin and enter my patient's room. So knock, knock, knock. Hey, my name is Aubrie. I'm gonna be taking care of you today. Can you verify your name and your date of birth for me? All right, great. Do you have any allergies? I'm here to place this TB skin test for you. It should only take about 2 to 3 minutes. Do you have any questions? All right, awesome. So I'm gonna go ahead and with my patient had just recently moved here from India with his family. So I wanna make sure that I understand his TB skin history as well as he understands what is going on today as well. So after I've provided my patient with some education about the TB skin test, I'm gonna go ahead and wash my hands, and then I'm gonna go ahead and position my patient's arm correctly. So I want it to be extended outwards, and I'm gonna be using the forearm, kind of the inside of the forearm as well. All right, so now I'm gonna go ahead and apply my gloves. And so once I have my gloves on, I'm gonna go ahead and grab my alcohol swab, and I'm gonna clean the forearm. And so say I'm gonna use my forearm, for example, I'm gonna clean it in a circular motion. I'm gonna also clean the surrounding skin using kind of like a circular motion and working my way outwards. Okay, and so then I have my TB syringe bottle as well, and I'm gonna go ahead and clean that as well with a separate alcohol wipe as well, and let that dry. Okay. So now I'm gonna go ahead and make sure that my my needle is securely attached to the syringe, and I'm gonna go ahead and pull back some air first. So 0.1 air. And what I'm gonna do is I'm gonna make sure that I inject the air first, and then I can pull back on it. And there we go. And then I'm just gonna gently tap on it to make sure I get all my air bubbles out, and then I expel all the air from the syringe and any excess solution. So that way I have the correct amount, which is 0.1, which you can see in the syringe. All right, so now I like to use, all right, so I'm gonna go ahead and stretch the skin taut over the injection site, and I'm gonna go ahead and insert my needle at the proper angle for the intradermal injection. I'm gonna go ahead and insert it. All right, and now I'm gonna go ahead and inject the solution. And I want to form a wheel that's about 6 to 10 millimeters. All right, and I'm going to go ahead and remove the needle without massaging or pressing down on the area, and I would go ahead and activate my safety device. With this needle, it doesn't have one, so I'm just going to pretend and discard of it into the sharps container. All right, and so if minor bleeding would occur, I would just go ahead and dab the injection site with like a cotton swab or a gauze, a dry gauze or something like that, just lightly dab on it though. And then I'm gonna take off my gloves and perform hand hygiene. And then what I want to do is I'm going to go ahead and record the time, the date, the location of placement at the injection site. I also want to date the location, the manufacturer, the lot number, the expiration date of that, and then also my student initials on the form. And then I would give my patient some education on how to take care of it. So we don't want them to like massage it real hard when they're taking a shower or anything like that. And then explain some normal reactions of the skin test as well. And then I would go ahead and make sure that I very much so give him instructions on returning about 48 to 72 hours later to get the TB skin read. And since he is from India, if there's a culture about like language barrier, I would make sure that he understands before leaving that he needs to come back within that time frame. And then I would also give him like an appointment card as well to help him remember. Okay, so now for the reading of the TB skin test, I would go ahead and gather my supplies. So all I need for this one is just a millimeter ruler. And now I can go ahead and enter my patient's room. So knock, knock, knock. Hey, I'm Aubrie. I'm going to be your nurse taking care of you today. I'm here just to read your skin TB test. Do you have any questions? It should only take about 1 to 2 minutes. Can you tell me your name and your date of birth? All right, awesome. All right, so now I'm going to go ahead and I would just give my patient a little bit more information about what I'm doing and how I'm going to read the skin test, and make sure that they're in that 48 to 72 hour window as well. All right, so now I'm going to go ahead and wash my hands and perform hand hygiene, and I want to inspect my patient's arm in a well-lit area. So now I have that the lights on, everything's good. And then I'm going to go ahead and locate the site of the injection site. So say it's right here on my arm. And then I'm gonna make sure that my the arm is slightly supported and slightly flexed at the elbow. And then I can just go ahead and touch the area lightly with the pads of my fingertips, sweeping in a 2-inch diameters, I guess, from the injection site. And I would do it in all 4 angles, so kind of like a T, like that. I just want to locate the edges of the induration. And then using a zigzag feather-like touch, I'd go ahead and palpate the induration's margins as well. And then I can repeat the palpation with the patient's arm raised at a 45-degree angle to get it on a different angle. So now it's at a 45-degree angle. I'm going to move the fingertips forward towards the injection without lifting it. So I lift it at the end, but the whole time I'm there. And then I'm going to go ahead and locate the induration again with my fingertips, and I'm going to rest it firmly on the induration margin. So with my patient, he has a 15 millimeter induration, so I'm going to go ahead and get my ruler out for this one. And so you can also use like a fine pen as well. And so using my paper, I'm going to go ahead and I'm going to use my pen, and I'm going to mark the widest dots. Okay, so the edges on the widest. So say this side and this side is the widest right here, and you can measure it. So 15, excuse me, and then 15. So the widest edges of that right there, and I'm going to mark it with my pen. And then I'm going to locate the induration margin on the other side of the patient's forearm, and I'm going to place that second mark, which I did. So both of them are there on both sides. And then I'm going to use my millimeter ruler, which I already did, and I measured the diameter of the induration. So like I said, it was 15 millimeters long along the axis of the patient's forearm. And I really want to make sure that I measure only the induration and not the redness and the erythema. And so that's important to remember moving forward. And then I placed it on the 0 line of the ruler. And I'm going to read the ruler on the inside of the right dot. So there you go, 15. That's it. Okay, so I would go ahead and place the 0 line ruler inside of the left dot edge, and then I would read the ruler line inside the right dot edge. And so then I just want to make sure that I have correctly verbalized the induration of my patient's reading. So like I said, it was 15 millimeters. So I want to make sure that I correctly document that. And then I also want to go ahead and record the date and the time of the reading as well. I want to record the my name and my signature, and then the presence or absence of any type of adverse reactions like blistering, redness, swelling, anything like that. And then I also want to make sure that I educate my patient on the significance of either a positive or a negative reading. So I would give him some more education moving forward and the steps next to take for that. And I would direct my patient, since he was positive, for a follow-up as well. And then I'm going to provide documentation and a copy of his TB test record. And I would explain to the patient the importance of retaining this information. So he needs to keep this for his own personal record and make sure that he keeps his documentation since he was positive. And then, like I said, he is from India. He recently just moved here, so he does have a culture and language barrier. And so I'm going to make sure that I give him proper education, and that someone else, if it needed to be like a language interpreter or something with him and his family, has the proper education and material as well to that patient. And then I'm going to go ahead and wash my hands. I'm going to thank my patient, and then I'm all done.